Hi, I'm Naisha McCauley, and you're watching accesstv.org.
Hi, I'm Dr. Helen Newton, and this is Everything is Health. We are standing today in Charter Oak Health Center, located in Hartford. And with me today is Mr. David Sample, who's the Chief Executive Officer, and Ms. Joanne Boudoir, who is the Chief Nursing Officer. And today we will go on a walking tour through the health center here. So please come with us.
Okay.
What we do here is the nutritionist as well as the diabetic educator actually hold classes for our diabetic clients.
Wonderful.
And they are taught how to cook. Many of our clients are low-income clients, so as well as learning how to cook with healthy foods, they're also taught how to shop wisely to stretch their dollar and to still be able to buy nutritious foods.
Yes.
We do demo cooking here. They learn how to put all the ingredients together. She also does grocery store tours where she teaches clients how to shop. Best areas are at the perimeter versus the aisle, and she teaches them what to look for. So they come in, they learn, they also manage their blood sugar that way, they follow up with their providers, and they learn healthy eating and healthy lifestyle.
Very nice. Now, do you cook any ethnic meals here?
Yes, we have a very diverse population.
Yeah. So are the nutritionists who work here, are they also, is there a diversity among your nutritionists?
We actually only have two right now.
Okay.
One is a registered dietitian and the other is a diabetic educator. So while there may not be diversity among the two of them, there is throughout the center. So we often will pull in our medical assistants who will either translate for them, speak Hispanic or Eastern European, Bosnian is another language. And they usually come in and they will help to construct the classes with them.
Yes, that's very important, very important. Because we have also, you know, I'm at St. Francis and we do see probably some of the same patients. And for instance, if we have a patient who might be from Jamaica, let's say, if they're talking about callaloo and the person who's you know, advising them, they don't know what callaloo is. It's very hard to tell them whether this is something nutritional or not, which in fact it would be very nutritional. So what you're doing here is really exceptional. This is absolutely a beautiful kitchen, and I think that it speaks to prevention. This is the preventive part of medicine, and this is the part that usually gets, you know, sort of swept under the rug, so I'm happy to see it, you know, very out in the forefront. This is wonderful.
We have a connection, Lori, as well, is very active with the local food banks.
Food share.
So we're able to get a lot of, you know, stuff from Food Share that we can also share with our clients as well.
Wonderful.
So it is very focused on wellness and prevention and health maintenance.
Wonderful. Thank you.
Welcome. Right here. So you saw one of our nutrition services. This floor is also our behavioral health services. So clients, you know, come here by scheduled appointments. We also have intervention services here as well.
Okay. So you have both psychologists and psychiatrists on staff?
Yes, we have, that's right, licensed clinicians and psychiatrists.
Okay. That's
Again, provide a full range of services.
So you have 2 exam rooms?
We do.
Oh, okay.
2 exam rooms. We have a screening room here as well.
Okay.
Eventually, this will be outfitted to take care of patients in its entirety. Right now, they're being registered in another location down the hall where behavioral health services was, but eventually this will be self-contained. And we're looking into also providing potentially eyeglass services for
Wonderful.
that as well.
So really one-stop shopping. Yes. Very important.
Screening?
Screening and exam. Oh, nice. So you have a, complete range.
And this was just vacant space here. And
So, and I know, of course, I know that you have electronic health records throughout the facility, which is really nice. Can they communicate with any other facility outside of Charter Oak?
Unfortunately, not at
Not
this
yet.
point.
Yes.
We're hoping that someday we'll be able to
To
get
do
there,
that.
but right now it's just within our own system.
Yes. This is beautiful. Very nice.
Thank you.
Right. Our laboratory is run by the Hartford Hospital's
Yes.
laboratory, and the radiology suite here will also be operated by Hartford Hospital.
Very nice. Okay.
And that'll be another project Joanne's been working on, almost
Yes.
brought to fruition.
Yes.
We're also going to have the ability through Hartford Hospital Services and their mobile medical unit to do mammography screenings for patients. Also focusing on potentially those women who can't afford and
Yes.
need some low-income screening.
Yes.
And we'll be able to provide that for them. So we'll have optometry, radiology, and as David mentioned, we just have CLP, clinical lab partners, in here too. And we also have a pharmacy on site. So
Yes.
we really have an all-encompassing service for the patients.
Right. About how many patients come through your center in a day?
It could be anywhere as high as 400.
400 in a
Yes,
day.
Yeah, and sometimes that's just scheduled patients.
Yes.
And then we also see walk-ins as well.
Okay.
We have an urgent care center on the first floor. That sees mainly walk-ins, no scheduled patients per se. So
Yes.
anyone that has an urgent need is welcome to come in, and they come in through the urgent care.
Yes, very nice. Okay, now how many primary care physicians are here?
We have approximately, in internal medicine, there is probably about 20 or so providers that just practice family medicine, but
Yes.
throughout the facility, including the specialty areas, we have about 50 or 60
Yeah,
or so
45 or so,
providers.
yeah.
Oh,
And a
that's-
combination of physicians and advanced practice nurses,
Yes.
physician assistants.
Physician assistants. Very nice. But when we walked into the receptionist area, I noticed that you had signs both in Spanish and English, which is so
Yes.
important. And would you care to comment at all about maybe the class standards and the importance of communication to patients in their native language
Absolutely.
in terms of quality of care?
Sure. It really basically starts on entrance to the
Yes.
facility. We have 65% or so of our patients is a Hispanic population here. So it's extremely important that we be able to communicate with them at all levels. And it
Yes.
starts with the patient walking in. Many of them need direction as to, where do I go? I'm here to
Yes.
see my provider, but where do I go? So we try to hire as many, again, diverse and bilingual individuals as possible, because that communication with the patient, not only from when they present, to ensure that we acquire appropriate information, demographics, where
Yes.
they live, phone number where we can reach you, important contacts, filling out all the required paperwork. But it becomes even more important when they reach the back clinical area and meet with their provider. They
Yes.
need to be able to communicate their health needs, their concerns. We want to be sure that we're educating them appropriately,
Yes.
and making sure that they understand what they're being educated on. So that piece becomes critical in
Yes.
terms of patient care.
Absolutely. What happens if a patient walks in and he or she speaks Yoruba or Cantonese? What do you do?
Well, unfortunately, we don't have many employees here that can speak that language. However, we do have what we call language line, and we offer the ability to use a handset and call a number, and that line comes with many, many different languages. So we're lucky enough to be able to have that service here, and that will at least at minimum help us to translate between patient. Though it's not very personal, but it allows the patient to communicate with us and then us with them.
Yes, very important. Yes. Oh, lactation, do you do a lot with breastfeeding?
To accommodate our patients, a lot of moms, what OB-GYN unit is actually on the second floor. They also have a changing room and an area there. We try to make it comfortable for them. And this is our pediatrics.
Colorful?
department. Yes,
Yes.
colorful, white and cherry.
Yes, yes. What would you say is your biggest nursing challenge in terms of the pediatric population?
I think because of our location and the distance and the amount of children we see from a variety of settings, that probably the biggest challenge is ensuring that we have all the appropriate immunization information. It's sometimes hard to get that. Some of them come here from having seen other providers at times. Some come from having had the immunization history only at the school, and sometimes those things are challenging. And of course, within a certain population and age group, you want to be sure you have a complete immunization history to keep the children well. So that's probably for this population the biggest challenge.
Okay. And what about autistic children? There's we were contacted in our office about the rise in the incidence of autism and other developmental delays, corresponding to that in the pediatric population. Would you care to comment?
Yeah, we don't see a huge number of children with those types of special needs, but when we do, we have networked with a lot of the community area providers so that we can make the appropriate referrals. We see adolescents and young children who might need behavioral health services that are perhaps something that we can't provide here down the hall, but we can, associate them and network them with other referring agencies that we have partnerships with.
Okay.
So.
Right. The dental clinic is open 5 days a week, all day.
It's actually open Monday through Saturday. The center is open on Saturday from 8:30 to 2:30 right now. And so we provide services for pretty much all of our services, with the exception of OBGYN is not open on weekends, but everything else is here and functioning on the weekends as
Yes.
well.
Wonderful. Do you have any evening hours?
We do. We're actually open till 6 p.m. right now. We were open a little bit later. We were open till 8 p.m., but we have done some utilization and determined that after 6 p.m. it really starts to slow down.
Yes, okay.
Most of our patients are looking to access us during the busy times of the day.
Yes.
And on Saturdays really only half a day, which is why we made a decision to adjust our hours according to our patients' needs.
Wonderful. Now, what do you do if a patient has a complaint or if they want to file a grievance? Do you have a way for a patient to be heard to the administrators? What do you
and
do?
actually David can probably talk. We're just starting up our patient
Yeah.
advisory group.
Yeah, there is a mechanism, but we don't believe it's really been nearly enough. So we are recruiting patients to serve on a patient advisory committee, so we can really get more regular feedback. And federally qualified health centers are really quite unusual in that the board of directors needs to be made up of the majority of them need to be patients of the clinic. And so we are going to use this patient advisory council not only to hear what their concerns are, what we can do better, but to help us learn about people who would be future board members. And that's a direction we want to emphasize more going forward.
Yes,
Yeah.
that's very important. That's exciting, actually, to have community input, in a community facility, in a community center.
Right.
This is definitely a community center.
Yeah, I've been in
So-
not-for-profit healthcare for an awfully long time, and I've never seen an organization where the patients can have such significant input.
Now, any plans in the future in terms of becoming a patient-centered medical home? Or
So we've been working on it for a few years now, and we are planning to submit, hopefully, our application will be done and completed by June.
Yes.
And we will be submitting for a patient-centered medical home accreditation.
That's wonderful.
Yes.
Now, what would you say is the biggest difference between Charter Oak as a federally qualified health center and Charter Oak as a patient-centered medical home?
I think that if you were to be here during the day, you would really see that it really is patient-centric. The staff here is very dedicated to the patients that we serve here in the community. They develop a rapport with them. They really care about them. They take care of the patient as a whole. They really involve their families and their caregivers. Some of that is, again, cultural. Some of it is the need to have a family member there who's going to be their caregiver at home. So I think if you were here during the busy time, you would see that it very much is patient-centered. It really is all about the patient. They care about what they do
Yes.
here, and we do really good work.
Excellent.
Yeah.
So what happens if a patient comes in with no insurance, no money, they are seen and they need medications? Is that a problem in terms of providing the medication for the patient?
It can be at times. It can be. Some of the, our patients, because of the nature of where we are here, we tend to see that a lot of our patients have a high comorbidities. They have, they're sick patients. They have diabetes plus other factors that complicate their health. So sometimes the medications that they require are not inexpensive, and they're many at times. So we do work with them. We have a discounting program with our pharmacy where if they can't provide the medication themselves, we'll often refer them to other area pharmacies that we partner with that can provide medications at discounted or no-cost services.
Great. So as the Chief Nursing Officer here, what would you say is your biggest challenge, your biggest day-to-day challenge?
One? I can
One.
only tell you one. I think the biggest challenge is wanting to make sure that when we leave here at the end of the day that we've done the best we can for patients. I think that we often, all of us, at every level in the health center get so caught up in sometimes trying to just make everything work on a daily basis and sometimes putting out fires that we have to take a step back and say, what did we do today and what do we need to do tomorrow to make it better?
And Mr. Sample, as Chief Executive Officer, what would you say is your biggest challenge in the day-to-day operations
In the
of the
day-to-day
center?
operations?
Yes.
Well, it's balancing the books, providing the care, and managing the finances at the same time. So we're a not-for-profit organization, but that doesn't mean we can operate at a substantial loss. So we have to, in order to continue to see patients and take care of them day after day, year after year, we have to be fiscally responsible too. So
Yes. So how do you manage that balance when we do have a number of patients that their need might outweigh their pocketbook?
Well, fortunately, we get extra help from the federal government. We bill for all of our services if a patient's on Medicaid or Medicare or has an insurance plan. But the federal government, wants to make it possible for us to treat everybody, whether they can pay or not. So we get some extra money from the federal government, and that's very welcome. And from the state government too, the Department of Public Health and Social Services.
That's wonderful.
We do this as a mission, and it's very satisfying to take care of everybody, whether they can pay or not.
Yes.
Yeah.
That should not be a factor.
Should not, but it is in America.
Yes, it is. So show us the map you were telling me about that's
It's
here.
right here.
Oh, okay.
Right here, and we've I've seen people come up and say, look, there's Montenegro, there's Bosnia,
Yes.
and we have a lot of people from these countries, South American countries, Mexico, and they get it, they enjoy it, and they see it. A lot of different languages spoken here.
Thank you. So this has been the tour of the Charter Oak Health Center located in Hartford, Connecticut. We're so happy that you were able to join us and take the tour with us through this center. If you live in this area and you would like to come in yourself to visit, please do that. Don't hesitate. If you have any questions, you have two people right here who will be happy to answer them for you. I'm Dr. Helen Newton, and I'm here with Mr. David Sample, the Chief Executive Officer, and Ms. Joanne Boudoir, the Chief Nursing Officer at Charter Oak Health Center. Thank you and goodbye.